All right. What I'm going to be demonstrating today is a scapular neuromuscular control drill. And what this is going to do is increase neuromuscular stability and increase kinesthetic awareness of the shoulder, especially when the patient has had a rotator cuff injury, bursitis, an impingement, slap tear, or a Bankart lesion. The rationale is the force couples need to work together, and so by doing these control drills, they will increase stability and decrease and create an asymptomatic arm function, which means no pain and normal range of motion. So I have my patient lying on her side, and the affected shoulder is actually in the up position, and I'm in front of her. I'm going to bring her shoulder into 90 degrees of flexion, so you're going to line that humerus up with the AC joint. And then I'm going to have her internally rotated and her hand facing her. So it's actually here. If it go down a little bit, this is her correct body position. The camera's going to stay there. Hold on. Let's try that again. All right. So that's where we're at. All right. So in this position, I'm going to first have her do an elevation, so she knows what it feels like, and then a depression. And then I'm going to have her retract or squeeze her shoulder blade together, and then actually protract and bring it out. So I'm going to have her kind of go into that upward motion, and give her a force to press up against. And then I'm going to cut my hand up underneath her scapula, the angle of the inferior angle of the scapula, and I know you can't see it, but my hand is right at the inferior angle of her scapula. And so when she depresses, I'm going to actually create a force for her to press against. So press against me, now press up towards me, and then press down against me. So we're going to do some upward and elevation and depression, up and down, up and down. Now let's do some retraction. So I'm going to stabilize here, retract, and then protract. So we're going to have her bring her elbow out and then in. So push against me. So she'll be pushing up for protraction and then push against me for retraction. And so my hand is still at that angle of the scapula. Push against me, and push against me. So this is just I'm assisting in the upward and downward movement of the shoulder. We can also do upward rotation and downward rotation of the scapula. In this position, it's kind of hard to see, but I can also have her do an upward rotation, so she would be rotating up and out, and then I would do a pressure on the upward anterior portion of her scapula, right at the spine of the scapula, and then when she's pressing down, still at that angle, bring it down and in. So it's the upward rotation and downward rotation. So again, these are scapular neuromuscular control drills to increase arm function for anybody who may be in the second stage of rehab for a rotator cuff injury.